Hi, I'm Leigh. I'm a physical therapist assistant. I work at All Access Physical Therapy here in Sterling. Today we're going to be going over osteoporosis and exercise. So if you guys have any questions at any point, if things pop up, just feel free to interrupt, raise your hand, and I'll try and get to you as quickly as possible. All right? So, what is osteoporosis? It literally means, porosis means porous bone. So what happens is our bones are still living tissue. A lot of times we think of our muscles and our ligaments more so as living tissue, but our bones are as well. So from the moment we are born to young adulthood, our bones are developing and growing and strengthening. So normally around early 20s, early adulthood, we're at our peak bone mass. After that point, we start to decline, and this is because our bones function in a way where new bone is deposited as other bone is reabsorbed into our bodies. This is how we get stronger and they maintain their strength. After this point, they become a little bit more brittle and more prone to becoming porous, meaning literally like kind of like a honeycomb. So they're obviously not as strong or as dense as they are when we are developing. So osteoporosis is a disease that weakens and we lose the mass of our bones. So this is important because they become a lot more fragile and we're susceptible to fractures. So a lot of times this is referred to as a silent disease because we can't feel our bones weakening. It's normally not a cause for concern because we don't realize we have it until we have something like an incident like a fall and we end up getting a fracture. So it's not necessarily osteoporosis that is as big of an issue as it is when we get a fracture as a result of the osteoporosis. So with it, the bone loss is just constantly outpacing the growth of the bone and it doesn't have time to catch up. So for the next couple of slides, I put down a good amount of statistics. A lot of them seem lengthy, but I think they are important just so that we can understand the gravity of what can happen as a result of a fracture. So according to the National Osteoporosis Foundation, 9 million Americans have osteoporosis and 4 million have low bone mass. So a significant amount can cause us to be at risk for a fracture. This is indicative that 60% of adults 50 and older are at risk, so more than half. It's a significant amount. Studies report that 1 in 2 women and 1 in 4 men 50 years and older are at risk for getting a fracture as a result of osteoporosis. The most common fractures are of the spine and the hip. That's not to say that it can't happen with any other bones or joints, but those are the most common and often the most detrimental. Broken bones are painful at any age, but weakened and broken bones, as we get older, they can be deadly. So not only is it going to be limiting to, function and quality of life, but it could actually end up in death, which is serious. 1 in 5 people with a hip fracture will die within 1 year of their injury. 1 in 3 adults who lived independently before a fracture will remain in a nursing home for at least a year after their injury. This can also lead to isolation, depression, loss of your independence, and fear of falling, which alone can limit your stuff on a day-to-day if you're fearful from going to the grocery store because of a fall, or with us here in New England in the wintertime, it's pretty significant with the ice. According to the National Osteoporosis Foundation, about 9 million Americans have osteoporosis and 48 million have low bone density. again, I just put all these statistics down so you guys can understand how prevalent it is, and how we don't realize that we may have it. Just because we don't feel it does not necessarily mean that, we aren't at risk for having osteoporosis. So the next ones I go into a little bit more of statistics in terms of the hip and vertebral fractures, so fractures of the spine. Vertebral fractures can really result in serious consequences. Not only is it intensely painful in the back, it can also lead to deformity, loss of our height. This alone can cause, body issue images, functional losses as a result of your lungs being compressed. So pulmonary can also be become an issue just as a result of having our good posture, and then if we get a fracture in the spine, well, our bones aren't going to be strong, they're not going to maintain us up. That alone, compressing your lungs, is going to limit your cardiovascular and pulmonary function. Vertebral fractures are very common with osteoporosis. Statistics will say that they can occur 22 seconds worldwide in men and women over age 50. So you can imagine, since I started talking and giving this, how many people, have just developed a fracture in that short amount of time. Women ages 65 years or older has a 1 in 4 chance of another fracture over 5 years. And this statistic can be reduced by 1/8. So half of that just as a result of treating and prevention. So catching things ahead of time and making yourself educated about this can really reduce your risk significantly. After hospitalization for a vertebral fracture, there's an increased risk for further hospitalization within just several years after the first. So each time you develop a fracture, you're more than likely to fracture again within a short amount of time. Hip fractures. So again, I have more statistics for you guys. Between 1990 and 2000, there was a nearly a 25% increase in hip fractures worldwide. The peak number of hip fractures occurred between ages 75 and 79 for both men and women. So it's a lot more common in women than men. I'll go into that a little bit more within the next couple of slides. But men do account for 25% of the hip fractures associated from osteoporosis, whereas women account for 75%. So majority of the times it's in women than men. Yes?
You said that there was an increase between 1990 and 2000. Is there any explanation for that increase? Would it be diet, lack of exercise? Do you know?
The question was why there might have been an increase between 1990 and 2000 in terms of hip fractures worldwide. I don't know why that would be. I can make an educated guess that probably lifestyle changes. I think we've become more sedentary just as a nation, but I can certainly look into that and get you a positive answer. Yep, I'll make note of that. Just remind me at the end, I might forget. So hip fractures, like vertebral fractures, are going to be pretty limiting in terms of pain, reduced mobility, increased independence after a fracture, and a lot of times people who were community dwelling individuals will end up in a nursing home following a fracture, even further limiting your independence. And nursing home rates were, again, similar to what we were just saying, how within that time frame, nursing home admissions have drastically increased, and majority of them are as a result of falls and fractures from osteoporosis. 5 to 10% of patients that experience a recurrent hip fracture will likely fracture within the next 3 years following that first fracture. So again, it's, one fall can really be detrimental to your lifestyle and your health in general. And up to 20% of patients die within the first year following a hip fracture. A lot of that could be contributing to pre-existing medical conditions, but less than half who survive a hip fracture will regain their previous level of function. So even if it's not detrimental to your life and your lifestyle, you may not be able to get back to that point that you were prior to a fracture. So who is at risk and what leads to the development of osteoporosis? Sometimes it is just genetics and family history. So you want to be well educated on, who in your family has previously been diagnosed. Do you know anyone that you're related to that has fallen previously as a result? And just making it, educating yourself on, well, am I at risk because of this one thing? Some of these things are not modifiable, family history, we can't change that. That is why I am here. I'm gonna help you guys with all of the things that you can change to reduce any of your risk. So menopause and hormonal changes can also put you at risk. Again, this is why it affects women more than men. One of our hormones, estrogen, protects our bones. So after menopause, when estrogen levels drop sharply, your risk of osteoporosis increases. Hormonal changes too can occur if you have one of your ovaries removed. So again, that just is due to the rapid loss of your estrogen levels. Medicines for a long period of time can be harmful to your bones, most specifically steroid use, but anything long-term, you want to consult with your doctor and see, do I need to be on this for a very long period of time? Is there any way that can be modified to taking a lower dose? A lot of times we don't have the option, we have to take something. But seeing if you can modify the levels of what you're taking can make a difference. Steroid use is one of the more common or well-known medicines that we know can contribute to bone loss. And a lot of times these are the most powerful but beneficial for other pathologies or any other pre-existing conditions that we may have. But it is the one that will increase your bone loss the most. So again, seeing if there's any way that you can modify or discuss with your physician or healthcare provider, what else can I take with this to counteract some of the detrimental effects of what I'm taking. And that can be including appropriate supplementation with vitamin D and calcium. At the end of this slide, I have references and resources that you guys can have, so that way it recommends daily values for supplementation. I would advise that you guys discuss with your primary or any of your physicians to discuss what is the appropriate level that you should be taking based off anything else that you have going on or anything else that you're taking, just so that way you're taking everything safely in an appropriate amount. Other diseases, conditions, and medical procedures that can cause bone loss. These you want to make sure that, again, you're discussing with your doctor. I know I have this may put me at risk for development of osteoporosis. Is this something I should be concerned about? Is there any way that we can manage everything in a way that I can, again, just reduce further bone loss? So prevention, like I said, there are some things that are not modifiable, some things that we cannot change. The things that we can change are on the following list. So, like I was just saying, getting enough calcium and vitamin D. In your diet, at any age, you want to get enough supplementation with this, in combination with staying physically active, reducing hazards in your home. So this could just mean moving furniture around, so you have a little bit more space to move. You're not at risk of tripping over a rug. Maybe you can move it to an opposite room that you don't necessarily walk in all the time, or being mindful of the insteps that you have in your home. Little things like that can really reduce your risk of falling. Like I said already, talking with your doctors about medicines, taking ones or being mindful of ones that are going to protect your bones versus ones that may affect them in a negative way. Being underweight can also raise the risk of fracture and bone loss. So you want to make sure that you're maintaining a healthy weight. As we get older, our appetite will reduce significantly. So you want to make sure that you are getting nutrients and enough, I'm drawing a blank on the word, supplementing yourself enough with, enough nutrients, vitamins, and minerals, just to maintain overall health too, not just your bone health. Smoking and alcohol also are, thank you, she's good, she's telling me all these things. I need her up here with me, right? So smoking, you're gonna want to limit the amount that you're exposed to smoke in general, so even if you yourself do not smoke, you wanna limit yourself from secondhand smoke as well. And limiting alcohol use. So heavy alcohol use can reduce your bone mass. So you wanna make sure that you're not overdoing it as well. Yes?
What's heavy?
He's wondering what is a heavy amount of alcohol use. And pertaining to osteoporosis specifically, I'm not sure. Again, that's another thing that I could look up the exact amount for you. I would go by Surgeon General's recommendation, no more than 2. Limit yourself to 2 a day. Is that helpful? Again, if you remind me afterwards, I'd be more than happy to look it up for you. So some of the benefits of exercise, so we know that one of the main things in prevention that's under our control is the amount of activity that we're getting. So it's never too late to start exercising. I think that word intimidates us a lot of times if we're not an quote-unquote exerciser. Especially if it's something that we've never engaged in a program like that before. But a sedentary lifestyle, poor posture, balance loss, and weak muscles will also increase the risk of fractures. So by exercising, not only will you improve your muscle strength, your balance, your posture, but you'll also decrease any pain. And that's not just specific to pain as a result of a fall from osteoporosis, pain in general. This is gonna help with a lot of other aspects of your lifestyle, not just reducing your risk. So the biggest thing in terms of starting an exercise program is, one thing to think of is that not one program, it's not a one-size-fits-all thing. We are all different. We all have different needs. If you are unsure about, what is the best thing for me, well, first think, what do you enjoy? Preventing development of osteoporosis. Sorry, I lost my train of thought. You want to find something that's enjoyable so that way it lasts long term. And this is just going to benefit you in general, in terms of all aspects of your lifestyle. You're more likely to stick with something over time if it's something that you genuinely enjoy. before you start or choose to do any sort of exercise program long term, you might want to consider either a fitness assessment or a bone density assessment from your doctor, just to determine, well, what severity and what degree of osteoporosis do I have, or how great is my risk. Some of the things that might determine the type of exercise that you're looking to engage in are your age, the severity of your osteoporosis, current medications, your current fitness level and ability, any other medical conditions that you have, especially cardiovascular or pulmonary conditions, arthritis, and neurological problems, anything that could also affect anything that you're doing on your feet. One of the things to consider too is, what is your goal? Are you looking to prevent further development of osteoporosis, or prevent falls, or just generally improve your quality of life? The good thing is, with an exercise program, you're likely addressing all of those. You just want to make sure that you're doing so safely. So listen to your body when you are starting an exercise routine. I always tell people, trial something out. Don't go, crazy the first time that you decide to start exercising, like weekend warriors. I think we've all heard of those. But assess how you are the next 24 to 48 hours you decide to initiate something. If you are sore for days, that's maybe your indication that the first time you tried something was a little bit too much. There's a difference between muscle soreness and pain. So trying to be aware of which one is which to see how you should proceed next, or what the frequency is that you should start to before you get into your full-blown exercise routine. So there are many important pieces to developing an exercise program that will work best for you and kind of encompassing all areas of deficits. So these include strength training or resistance training, weight-bearing activities, flexibility and balance. Strength training is the use of free weights or resistance bands, or even your own body weight to help strengthen all your major muscle groups. This is going to be important for posture in general. A lot of times we think of, well, I don't want to do any back exercises because I don't want my back to hurt. A lot of the strengthening that you're going to do to strengthen your lower body, where you're required to maintain an upright posture, that alone is strengthening your back and your core enough to help posture, just in general. Resistance training is going to help maintain your bone density, and we emphasize weight-bearing activities, meaning something where you're putting weight through your bones. That overall is going to help us maintain our bone mass and limit any further development of osteoporosis, or at least hasten the timeline that it would take to develop osteoporosis. You want to tailor all of your exercises to your ability and your tolerance, especially if you have any other aches and pains. That's why it's important that you're speaking with either a trained personal trainer, a physical therapist, someone who knows your anatomy and your capability to tailor it to your needs and your comfort level. Weight-bearing activities might include walking, dancing, low-impact aerobics, machines at the gym like the elliptical trainers or the stair climbers. Even things like gardening are also considered weight-bearing. And although cycling and swimming offer great cardiovascular benefits and just general health benefits, they're not weight-bearing, so they're not working on your bones directly. Even if you want to include that in, I think that is great. But make sure that you're finding time where you're doing exercises where you're actually using some sort of resistance against your body, whether it be gravity and your own body weight or resistance bands to actually help maintain your bone strength. Low impact weight bearing exercises are going to be the best way and the safest way to do that. And I'll go into some high weight bearing exercises too that you should proceed with caution with. So flexibility exercises involve moving your joints through a full range of motion. So stretching. Stretching is done best after your muscles are warmed up. So I recommend to people that they're doing them after exercise because that's when your muscles are most warmed up. We used to believe that we needed to stretch beforehand. You would see runners before they go on their marathons, bending down and touching their toes. But your muscles aren't ready to go to that extreme if there isn't blood flow to that area. So more research now is suggesting that stretching should be done after your exercise because it puts you more at risk to stretch before, since the muscles just aren't prepared for that degree of stretch yet. You want to avoid stretching directly at your spine or something that's causing you to bend at the waist. So like I was just talking about, we know of runners who bend down and touch their toes. With osteoporosis, even that simple movement alone can be enough to cause a vertebral fracture. So you want to be mindful of your body mechanics. If you decide that you want to end up stretching, hamstrings or muscles on the back of your leg, you want to do so with modifications to the way that you're doing it. There are many different ways to stretch the muscles in different positions. And if you're unsure, ask a personal trainer, physical therapist, somebody who knows the anatomy well enough to make modifications that you need to stretch safely. Stability and balance exercises are especially important for osteoporosis because they reduce our risk of fall. We lose our balance if we don't practice. We use it if we don't use it. How often can we say that we are just, spending our time at home practicing our balance specifically? Not many of us. You want to incorporate as many balance and stability exercises and challenges that you can, but in a safe way. So even something as simple as standing on one foot and trying to balance at your kitchen sink. I always recommend that my patients try and do these things as long as you have something sturdy to hang on to, not a chair because that moves, but something that, if you lose your balance, that you'll have something to grab onto. Tai Chi, I think, is a great way to practice balance and stability because you're moving at the same time. More and more research suggests that this is gonna improve the quality of your life, not only physically, but also mentally. And I would be more than happy to provide you guys with information on that if anyone had an interest. A lot of people ask about yoga and Pilates because those are very well known for being weight bearing, low impact, good way to stretch, lengthen the muscles. Certain poses may not be the most beneficial or safe with osteoporosis. So if you have known osteoporosis and you decide you want to participate in a class, speak with the instructor, speak with your healthcare provider before, see if there are ways that you could still participate, but doing so safely in a way that you can modify some of the stretches or flexibility exercises that you guys do. So movements to avoid if you are diagnosed with osteoporosis include high impact exercises and bending and twisting. So activities like jumping, running, pounding type of movements, bouncing, those can easily lead to fractures, along with jerky or rapid movements. So you want to make sure that you're doing slow, controlled movements. But if your activity level and if your ability is a little bit higher, If you have already been engaged in an exercise program, you might be able to perform some of these exercises a little bit more safely. I always just caution people ahead of time, just be aware, be careful, and be mindful of your movement if you do decide to participate in something that's a little bit higher impact. Same thing with bending and twisting. You're at an increased risk of compression fractures of the spine if you do a lot of bending, twisting. So activities like bowling or racket sports, golfing, yoga poses, if that's an activity that you are used to doing, you just want to be mindful of the frequency and the amount that you're doing things and to the degree that you decide to participate in some of these activities. I certainly never want to limit anybody from the activities that they're doing, especially if they're the most enjoyable and it's overall going to improve your health. But I just do want you guys to be aware of some of the risks that are associated with them and seeing if there are any changes that you can make to it to just make it more safe for you. So the recommendation guidelines, this can change for everybody. Like I said, we're all different. Not one person is the same, so what might be right for you is not necessarily right for the next person. Generally, they recommend that for aerobic activity, you should be participating in 45 minutes to an hour, 2 to 3 times per week. Most of these are 2 to 3 times per week. I recommend to people that they spread them out on different days. That way you're not leaving yourself too sore or out of commission to do any of your other daily things for the remainder of the week. Resistance training, like including the use of the free weights, resistance bands, stuff like that, should be performed 2 to 3 times a week. They should include overall muscle strength, so more so multi-joint, things like squatting, lunging, while you could be doing bicep curls, and that's beneficial too. You'll get kind of more bang for your buck if you're doing things that are working more than one muscle group and more than one joint at a time. And a lot of times that's more functional too. We barely function in a way where we isolate our muscles at a time throughout the day. So participating in activities where you're moving more than muscle group or joint at a time is going to benefit you more. Each exercise that you perform should be done for 8 to 10 repetitions, 2 to 3 sets. That's typically what's recommended for each. Balance exercises, you want to make them challenging enough where it's a challenge for you. If you're able to stand on one foot and it's super easy, well, you're not really benefiting yourself much in terms of making it a little bit more difficult. You want to participate in these activities for few minutes at a time. Balance is a lot harder than we think. So adding up to maybe 3 minutes to start and then eventually getting to 5 minutes would be an ideal way to kind of progress yourself if you're working on static balance, meaning balance in one position. That's not very functional on our day-to-day. We work in a way where we need our dynamic balance, where we're moving at the same time while we need to remain on our feet in a steady manner. And that can be done with use of uneven surfaces. So maybe if you're challenging yourself on a pillowcase, again, I would do all of this stuff with something that you can hang on to, just in case you lose your balance and need something to hang on to. And like I mentioned before, stretching following all of these sessions. So I included an example exercise program of everything that we just discussed. Warming up with 5 minutes of an activity that's going to stress the same muscles that you're going to be participating in. This can be done just by walking. A lot of times that's going to hit our global muscle groups of our legs. And then going through maybe one set of each of the exercises that you plan on participating in, just to get those muscle groups warmed up, but not necessarily at the degree that you are planning on doing them. So if you're planning on doing squatting with 5-pound weights, maybe just do a body weight squat and not necessarily as far down as you would go when you're planning on doing your actual exercise, but enough so that you're warming up the same tissues that you're going to be working. So I listed 7 exercises. These are all total body, kind of hitting the posture muscles, working on our stability, and hitting multiple muscle groups at once. So I can demonstrate some of these ones. A lot of them we already know, but I figured it'd be nice to have a reminder just to make sure that we're doing everything with good body mechanics. Like I mentioned before, if you are unsure whether or not you were doing it or not, ask a personal trainer, ask somebody who knows the body, ask your primary, is this going to help or hurt me? Should I be avoiding this? Should I not? And that's ultimately going to tailor your program to you the best. So squats or sit to stands, I like to demonstrate this one with a chair because it's good to have a cue for your hips. So a sit to stand is exactly what it sounds like. You are sitting and then you're going to stand up. So I like this because it just mimics squatting. It works the perfect way. You use your hips. A lot of times when we think of squatting, we're trying to keep our body in the air, that we're not paying attention to what our knees are doing. So you want to make sure that the motion is coming from your hips. So even if you decide that you're not going to put your full body weight down to sit, if you decide you want to hover, you still want to use a chair as the cue to make sure that your hips are being pushed back. So you want to make sure your hips are pushing back, and then you're using them to push you back up. This is going to make sure you have a hip hinge to avoid any sort of excessive weight and load on the knees. This is a lot more for my knees to handle as opposed to this. So our hips are bigger, they have a lot more musculature to support us in those positions, so we want to make sure that those are the ones that we're strengthening. Hips I also consider a part of your core. That's going to ultimately help keep low back, spine, everything in good alignment. And that's why I emphasize the importance of an appropriate hip hinge as opposed to letting the knees bend too much. The next one is a row. So this is going to help upper back and postural muscles. So if I were to have a resistance band in front of me, I want to make sure that I'm pinching my shoulder blades back and then pulling to the side, like so. If I had a resistance band, I would show you, but that could also be done in several different positions. Sometimes people will bend over and they'll do the same thing. I would say that you would want an extra hand to kind of support the rest of your body weight, and you're paying attention to the rest of your core. So that way, again, we're avoiding some of those positions where we end up flexing over. Box step-ups. So this can be done with a stool, a sturdy book that we have at home, as long as the pages aren't flying around anywhere. But it can be something as small as, encyclopedia, dictionary, or something that is a little bit lower than this chair height, or steps. Stairs work great too, as long as you're doing something that's for repetition. Just stepping up and then lowering yourself back down. Push-ups. These ones are also great. How much can you see? I still want everyone at home to be able to see, but I always recommend people do these on an incline or a wall to start, just to see what your level is. How difficult is that position? Sometimes even getting into the position of a push-up is enough of a workout alone for us, and you're still going to get the core benefit, the weight bearing through your arms, and also the muscle strength for all the posture. So it would look similar to this. All right, so you want to keep core engaged, lower yourself down, push back up. All right, could be done on a wall or higher surface too. I'm sorry that my back's going to be to you, but I just want to be able to demonstrate. Right? Not bad? Hopefully your push-ups are going to look a lot better than mine, right? A plank or a bird dog. So a lot of us have heard of a plank. A bird dog is kind of a regression from a plank, but I think it's a lot more beneficial because you are working both sides of your body. Same thing as with a push-up for a plank. You can start out on a higher surface, which I would recommend everyone does, so that way you're making sure the rest of your body is in appropriate alignment. So a plank would look like this. And then a bird dog can be done either on the bed, on the floor if you don't have a difficult time getting up and off the floor. The bed will be a little bit more challenging because it's an uneven surface, which I think is great. Make it more challenging for you, but in a safe way. That's awesome. You'll only be able to progress yourself from that point if you make it hold for a longer duration. So a lot of these can just be held in certain positions like a plank. Same thing with the push-up. You could just hold yourself in that same position and you're still getting the benefit of putting weight through your upper body and working on core strength at the same time. So this is a bird dog. So one arm, you're gonna be in hands and knees position. Can everyone see?
Yes.
You're gonna alternate one arm and one leg. So you can make that more challenging by extending out and holding for a longer period of time. And then you're gonna alternate back and forth between the two. So there are many variations to those. That one I'd say is a little bit harder. You could try the same thing with just doing your arms. Try alternating your arms and keeping your hips and everything else in the neutral alignment. Same thing with your legs. If the arms are too easy just to alternate while keeping your legs in the same position, just alternate your legs and try holding and see how long you can hold in those positions with the appropriate technique. A lot of times if it feels too easy and you're able to go pretty quickly, reassess posture. See if you can have like a stand-up mirror next to you. Doing it in the gym where you have a lot of mirrors or cues that can correct your posture. And the last one, oh, there's shoulder press on there too. So I added in a shoulder press one for free weights. Now, a lot of times, shoulder press is not the most comfortable for us. Pushing things up overhead or even reaching overhead might not be too comfortable. So there's modifications that you can make to that, but I wanted to include an option that you guys could do something with free weights with an overhead motion because it is important that we're still able to get into those overhead positions. A lot of times just for daily tasks, reaching up into the kitchen cabinet, grabbing a coffee cup, something that's weighted over our head, we want to be able to have the appropriate posture and strength to complete those. So a shoulder press, I recommend most people do it sitting because then you can take out the rest of your body that may be compensating to try and achieve the motion. So you'll want to sit, of course, with everything. I harp on this for everyone in physical therapy. Posture. You want to make sure that you're sitting upright before you decide that you want to add any sort of movement in. So your belly button is in, your shoulder blades are back, and you want to push up overhead and then come back down. Again, all of these can be modified. You don't have to add any weight to it. If you feel like reaching overhead alone, that's enough of fatigue for your muscles. Determine that with your warm-up. You know, like I said, if we're going to be doing all of these motions, see if you can do them without any weight. And if it feels okay and it's not fatigued after the 10 repetitions that you do without weight, well, try lightweight. Start with 1, 2, 3 pounds and see how it feels and work your way up from there. The last one I included are lunges. So these ones are also harder. I would recommend that people have something to hang on to because it's going to include balance in it. So a typical lunge, a lot of times people will lunge forward and then come back down and push back. You could do the same thing, reaching behind, lowering, and push back up. Again, I would start out light, see if you could just go back and see how you are in that position. This alone is a balance exercise. See if you can hold yourself in this position. If that's a challenge, good. Keep doing that. That's what you're going to do for repetition, right? So if you're feeling like, oh, no, I want to go through the full range, I want to get the full benefit of my muscles, I would say just hang on so that way you're taking out that balance aspect and that way you can do everything appropriately. Yes?
The lunge, going backwards or forwards, are they different muscle groups?
They will be a little bit in terms, the question was if with the lunge that they would be hitting different muscle groups, whether you go forward or whether you go backward. So depending on which leg that you're using, you're going to be working different muscle groups. So if I'm lunging forward with my right one, it's going to be more my quads and my hips whereas my back one is just kind of the stability one. If I'm going backwards, now I just switched. So now my left one is going to be my quads, my glutes, my hips, and pushing up is going to be working it a little bit differently. A lot of times when we're in these positions too, it puts a stretch on one side of our hip flexors. So a lot of times people will end up feeling it more in the hip flexors than they will in the glutes. And that just means that your hip flexors are a little bit tighter. You might want to include that in one of your stretches following the exercises that you're doing. If you're unsure, you're going to want to ask a personal trainer, somebody who knows the anatomy, someone again who can tailor it to your needs exactly. Was that helpful?
Yes, thank you.
How are we all doing? Good? No one's sleeping yet, that's good. So the last page, I just gave you guys references and resources. They include a lot of the similar things that we talked about today, some in more depth. If you guys have any questions on anything, we're right down the road, All Access. I gave Veronica my card, my email, and my phone number and the clinic's number. So that way if you guys have any questions, especially if you're looking to develop an exercise program, come see us. We've got pictures. I'd be more than happy to explain exercises to you guys. But a lot of it too is just being aware of what risks you may have and what you can do to prevent it or further prevent any further bone loss, mostly to keep you guys safe and improve your quality of life. So any questions, feel free to ask me right now, right afterwards. Give us a call or an email, I'd be more than happy.
I was wondering if you could demonstrate what you refer to as a dual stretch, where you're using different muscles of the body for the same exercise?
Oh, yes. So she's wondering if we could demonstrate something that's like a dual exercise where we're using different muscle groups and different joints, so that way you can kind of get the maximum benefit of doing all the exercises. So these are all the ones that I just listed. So for a squat, I am using the muscles that surround my knee, my hip. Yes, a lot of them are similar, but this is referred to as a multi-joint movement because I'm using my knees, my ankles, and my hips, and I'm working on my core control to try and stay. So even though we think of squatting and sitting and standing as a leg exercise, we have to have the appropriate posture and maintenance of our core control in order to do this correctly. So you're getting the benefit of also strengthening your core at the same time. I could do the same thing like this, but see how I'm rounding forward here? If you're paying attention to your posture and doing the exercises correctly, you're getting more than the benefit of just the body weight from in the legs. Same thing with a plank. So I'm working on, even though it seems like I'm staying in the same position, like this, if I were on the floor on an inclined surface, I'm working the muscles that attach to my elbows, the muscles that attach to my shoulders, all of the muscles along my core, my hips, my legs need to stay in that straight position, so it's even the muscles on the front side. So these ones I try to all include to make them more compound movements, again, so that way you're getting the bang for your buck if you're going to be participating in these exercises. Or as I said before, a uni-joint movement or a unilateral joint movement would be kind of a bicep curl. So with this one, I'm not necessarily using any of the muscles responsible for my core. Yes, to do these correctly, I need to have some good posture, but I'm really just doing the muscle on the front of my arm, my bicep, including ones like push-ups. That you're including your biceps, your triceps, your chest muscles, and your core because you're keeping yourself in that straight line position. Was that helpful?
Yeah,
Okay.
very good.
Any other questions?
Yeah, I have,
Yes.
in order to utilize or to access the All Access program, do you have to have a referral or can you just come?
So she's wondering if she needs a referral, or if anyone needs a referral to come to All Access. So for physical therapy, it depends on your insurance. If you are looking to participate in an exercise program and safely, then we would probably need to set up something more like a free screen, which is a little different. You could come in and set up an appointment. You don't need a referral, but a lot of times that's more so if you have some sort of pain that's limiting you from participating in an exercise program. If you're coming for an injury specifically, depending on insurance, you're more than likely going to need a doctor's or physician referral. If you are just looking for resources to personal train, we do have our personal training over in Shrewsbury. I know we don't have one in Sterling, which would be awesome. I would love that. But we have a lot bigger of a facility over in Shrewsbury, and we have a bunch of different personal trainers that we could set up that would be an appropriate match for you guys. I have all of that information too that I could give to you guys and set you up with somebody over there if you're willing to take the trip to Shrewsbury.
A long walk.
Long. Any other questions? All right, thank you so much.